Hello, I'm Denise Medved, and I'm the creator and founder of the Ageless Grace Brain Health Program. Today, heart disease is still a huge concern with people everywhere. So is cancer. But the number one concern of people all over the world is losing brain function as we age. So there is a program that not only addresses the physical skills that a person needs to stay functional for the rest of their lives, but also addresses the 5 primary functions of the brain. And it's called the Ageless Grace Brain Health Program. It's being taught in all 50 states, in senior centers, hospital wellness centers, medical communities. It's being taught in continual care residential communities in all 4 levels of independent living, skilled nursing care, assisted living, and memory care. It's been researched by several universities and medical schools. I presented the program at Harvard Medical School a couple of years ago to great acclaim from physicians, researchers, people in the field of gerontology and aging all over the world, and people really not only loved and felt like they could do Ageless Grace, but they felt like it was based on true science. The science that talks about neuroplasticity, which is our ability to change our brain and central nervous system regardless of our age, regardless of our physical abilities. The program is taught in a chair not because people are frail or old or have poor balance, even though they might have those things. It's taught in a chair in order to stimulate those 5 primary functions of the brain as they figure out how to do what we're asking them to do, seated rather than standing. So the 5 primary functions we address are strategic planning, memory and recall, analytical thinking, creativity and imagination, and kinesthetic learning. And whether your patients are very active and in their 40s or 50s but concerned about cognitive decline, whether they are 80 or 90 and they may have poor balance, or they may not have the physical stamina to do a traditional class, this program is designed for all ages and all abilities. Children can do it, 40-somethings can do it, 80-somethings can do it. I have students in my own classes that are in their hundreds, and they love and respond to Ageless Grace. The other market group that is very intrigued by and responds to beautifully Ageless Grace is people with moderate to advanced cognitive decline already. People with Alzheimer's, with Parkinson's, with some form of dementia. The kinds of games and activities we play in Ageless Grace, such things like Team Fit, where we act out different sports but seated, things like Shake It Up Baby, where we shake our body, things where we call Breathe Out Loud by singing and doing different kinds of verbal skills and activities, using our facial muscles in what we call saving face, working the heart, get down, get up, get down, get up, all in a creative and inventive way, all with stories, all with imagination. Those are things that stimulate the memory as well as those other 5 primary functions that I mentioned. And so even people with advanced cognitive decline will respond to Ageless Grace, even though they might not respond to many other things. So this is the ideal program. It can be done at home in their living room. They can watch classes on our website and join in on the website. There are teachers at communities all over the world called Ageless Grace Educators. We're, as I said, in 50 states and 30 countries. So there's always an Ageless Grace class, either virtually, online, or in person. I hope you'll consider next time you have a student, or a patient, pardon me, that says, my spine is stiff, my knees don't work like they used to, I'm starting to see my memory decline, that you'll think of Ageless Grace Brain Health and recommend the website to them, agelessgrace.com, or recommend a class to them that's nearby. Thanks for listening.